Hello students, today's topic is sex hormone related disorders. So what are the sex hormones first of all? So sex hormones are the group of hormones which are responsible for the normal functioning of the reproductive system in males as well as females. So they are responsible for controlling puberty, reproduction, birth as well as lactation. Sex hormone related disorders are also referred to as reproductive hormone disorders and are medical conditions that can affect the different glands and organs of the body responsible for production of the sex hormone. It is either an overproduction or underproduction of the sex hormone responsible for the sexual characteristics and development. So because of abnormal production of hormones, there are abnormal sexual characteristics. So normal physiology of the sex hormones: in females estrogens are produced by the ovaries, and in males testosterone is produced by the testicles or testis. Testosterone is also produced by the females but not in the balance than the women may experience. So testosterone is produced in very small quantity in the females, but if there is an imbalance or if it is overproduced, then women may have the characteristic features as that of men, that is menstrual cycle irregularities, hirsutism, that is extra hair growth on the body, and acne. When males do not produce enough testosterone, they may experience a decline in the libido or sexual drive, erectile dysfunction, loss of muscle and loss of body hair. Next is sex hormone disorders in females. So the first disorder which is most commonly seen in the females is polycystic ovarian syndrome or PCOS. So this disorder is characterized by oligomenorrhea, that is irregular menstrual cycles, or amenorrhea, that is absence of menstrual cycles, with symptoms such as hyperandrogenism, that is extra male-like hormones such as acne and hirsutism. This is the most common endocrine disorder in young females. Cysts may be present on the ovaries, which is called as polycystic ovary. The cause is insulin resistance, which is the most common cause, that is poor response of the body tissues towards the insulin. Polycystic ovarian syndrome can result in obesity, infertility, diabetes, heart disease, and uterine cancer. Exercise, weight loss, and medication can be used to improve the insulin sensitivity, and menstrual cycle can also be regulated with the birth control pills or hormonal pills. So this is the treatment of polycystic ovarian syndrome. Hirsutism, it is one of the sexually hormone related disorder. So it is the growth of excessive hair in the male pattern, including on the face, chest, abdomen and back in females. This is usually due to increased production of androgens or male hormones in females, which is abnormal. Treatment: topical treatment with the laser therapy, which can be used to reduce the hair growth, and reduction in androgen levels can also be done. Androgen excess. Androgen excess refers to the overproduction of the male hormones if it is there in the females. This can result from ovarian or adrenal tumors. In women, androgen excess can cause hirsutism, that is excessive hair growth on the face and other parts of the body, acne, male type of or male pattern baldness, that is loss of hair, menstrual cycle irregularities as well as infertility. Menopause is one of the common conditions which are occurring in the females. So it is a very much natural process, but it leads to the various problems in the females. So menopause is defined as the cessation of menstrual cycle, that is stoppage of menstrual cycle. So this usually occurs in the age of 50 and above in most of the women. So for 2 to 8 years after this, menstrual cycle may be irregular, and this may be referred as menopausal transition or perimenopause. As estrogen and progesterone levels decline or reduced, the symptoms which are seen include sleep disturbances, fatigue, irritability, decreased sexual drive, vaginal dryness, and depression. Long-term estrogen deficiency can result in osteoporosis, that is the thinning of bone, loss of calcium from the bone. Next is Turner syndrome. It is an inherited condition in which female is partly or completely missing one X chromosome. So the symptoms include short neck, low set ears, short stature, swollen hands and feet which are seen in birth during birth. They develop menstrual periods and breast only with the hormone treatment and are unable to have children without reproductive technology. Premature ovarian failure is another disease. It is also called as premature menopause. It is the loss of function of ovary before the age of 40. Amenorrhea is the sign and symptom. It is the absence of menstrual period in the women of the reproductive age, that is called as amenorrhea. Next, these are the sex hormone disorders in females. Now moving on to the sex hormone disorders in males. So it includes hypogonadism. Hypogonadism usually refers to the decreased production of the hormone, male sex hormone, that is testosterone. So this can be resulting from pituitary gland not stimulating the testicles or testis to make testosterone, or failure of the testicles to produce adequate amount of testosterone. The symptoms include decreased libido, erectile dysfunction, decreased energy, decreased muscle mass, thinning of bone, etc. Testicular size may also decrease and sperm count also will be decreased. Treatment: testosterone injections, gels or patches can be used. Next type of disease, sex hormone related disease in men is erectile dysfunction. This is also referred to as impotence. Erectile dysfunction is inability to acquire or maintain an erectile position because of decreased blood flow to the penis. Causes: smoking, diabetes, high blood pressure, alcohol, depression and some prescription medication. Gynecomastia, another disease, sex hormone related disease in males. This is increase in the breast tissue in the man and is referred to as gynecomastia. This usually occurs during puberty and get resolved on its own. Causes may be medications, hypogonadism, thyroid disease, malnutrition, testicular cancers, adrenal cancers, liver disease or kidney disease. Next disease is Klinefelter syndrome. So it is 2 or more X chromosomes in the males. That is, usually in males the chromosomes are XY, but in the case of Klinefelter syndrome it is XXY. So symptoms of this disease include weaker muscles, greater height, poor coordination, less body hair, increased breast growth, less interest in sex, reading difficulties, problem with the speech are very common. Symptoms are typically more severe if 3 or more X chromosomes are present. Other sex hormone related disorders: first is hermaphroditism. It is the condition having both male and female reproductive organs and it is referred to as intersex person. Delayed puberty: it is the condition with no physical or hormonal signs in the age of puberty. Precocious puberty: it is the condition where puberty occurs at unusual early age. Next is multiple endocrine neoplasma or neoplasia, that is tumors of the endocrine glands. So these are the different sex hormone related disorders in males as well as females. Thank you.